Well, we're here talking to Dr. Gomez, a dentist in Queens. In fact, as far as I know, Dr. Gomez, you have two offices. Is that right?
Yes, it is. I have two offices. One is in Corona, and the other one is in Howard Beach.
Okay, all right. Well, Dr. Gomez, most of us, patients, we kind of sometimes think a dentist is a dentist is a dentist is a dentist. And even though there's probably some truth in that, nevertheless, different offices do have a different philosophy and a different, way of approaching things. Tell me a little bit about your office, your philosophy, things you do, maybe things you don't do. Go ahead and shed some light on it, will you please?
Well, I try to fulfill all the needs of my patients, depending on, the situation. I try to prepare myself, take continued education. So any patient that comes to my office, I try to be prepared for the needs that that patient might need. Any situation that arises, I try to fulfill all my patient needs. So okay. I don't really see a difference between patients. I see and between the offices, I see differences between the patient's needs.
Okay, I got it. So is in your office, are you doing most of the work? You do the normal, fillings, pulling the teeth, doing the veneers, maybe doing implants. Are you doing orthodontic work? Are you kind of like most of the work in a patient needs is contained in your office? How do you operate?
Yeah, that's correct. I try to do everything in the office because patients, they don't really like to go any place else. They want to stay in their office. And once they get used to your office, they don't want to change dentists. They want to be seen by you. So every procedure is done in the office.
Got it. So like a one-stop shop, and you get the work done. I can see why patients like that, because after all, going visiting 4 or 5 or 2, 3, whatever different doctors, scheduling all that, it becomes a big hassle. And also some dentists have told me that, if you do most of the work together, then it's your picture, the dentist's picture, which obviously has an agreement with the patient's picture, and you can fit it better together. Otherwise it becomes like with computers. You call somebody up and they say, oh, it's a hardware problem, and you call the guy up and say it's a software problem, and you call that guy up and he finds some other reason why a problem, because nobody takes responsibility for all of it.
Yeah, that's right. When you see the patient, you see the problem, and the patient wants you to treat it. They don't want to be going around from one office to the other. They trust you, so they think whatever you want to do, you're going to get the best treatment or choice. And I try to do everything in the office because of that reason. And the other reason is sometimes you refer the patient to a specialist, and things might not be done the way you want it to be done, and then you take the responsibility for the problems that the other doctor causes to the patient.
Good. Well, all right. Well, thanks for filling us in about it. Very interesting. We're going to talk more about some other stuff specific on specific dental problems patients might have. Thanks a lot, Dr. Gomez.
You're welcome.